At this time, let's begin today's event, 2019 Healthcare Cost Containment Study, sponsored by First Stop Health and hosted by Employee Benefit Advisor and Employee Benefit News. I would like to introduce your moderator for today, and that is Walden Su. Walden, you have the floor.
Thank you, Jessica. I'm very excited to introduce two experts we have with us today, one representing the employer side and one representing the broker side. First, we have Christina Muscinesi. Christina is a partner responsible for Lanza's America's Total Rewards and U.S. domestic mobility program. Lanza is one of the world's leading and most trusted suppliers to the pharmaceutical, biotech, and specialty ingredients market with over 14,000 employees worldwide. Christina formerly was responsible for global benefits at Capsugel before their acquisition by Lanza in 2017. Christina has 10-plus years of experience in benefits, HR, and client services, with a degree in business marketing and information tech from Monmouth University. Christina, welcome.
Hi,
and
thank
second
you.
Up, we have Alex. Good to have you. Second, we have Alex Juneau representing the broker side. Alex is an assistant vice president at McGriff, Siebels, and Williams, based out of Metairie, Louisiana, with 12-plus years of experience within the healthcare industry. Alex and McGriff identified products and technologies that can improve the quality and effectiveness of their clients' benefit programs. In addition to research, marketing, and cost containment assistance, Alex and the benefits department offer services including online access to benefit information and claims analysis. Additionally, Alex leads a team that provides concise employee communication materials as well as regulatory compliance assistance. Alex holds her bachelor's from Louisiana State University, in addition to a Group Benefits Associate Certificate. So Alex, welcome as well. So Alex and Christina are here to provide real-time context to our discussion today, along with the real-time polling questions that Jessica mentioned earlier. Starting with our first slide, we are very excited to partner with First Stop Health to provide this online research that was conducted in February and March of 2019 to understand the cost management strategies used by self-funded employers and recommended by brokers. Out of 300 total respondents, we had about half of the employers who work in organizations with 500-plus employees with benefit decision-making responsibilities, with health plans that are self-funded or planning to become self-funded in the next 12 months. The other half are benefit consultants, brokers, and advisors who provide consulting solutions to organizations that also average 500-plus employees. So mark your calendars. This will be an annual survey that First Stop Health will be sponsoring. The goal of the annual survey is to provide insightful, third-party, validated data about how both employers and brokers view the best approaches to cost containment in the health care benefits area. In addition to the cost containment survey results, part of the value of this webinar will be 4 real-time polling questions, as Jessica mentioned earlier. So we will be doing these in 2 sets today. It will be 2 for employers and 2 for brokers. Our goal is to hopefully expose some new information about how both sides see the world from a cost containment point of view. So I hope you're all ready. Let's move to our first polling question. And a reminder that, again, that this will be done in sets. So starting with employers only, our first employer polling question: how often do new benefits that your company puts into place come from your benefit consultant's recommendation versus your own research? We'll give you about 30 seconds to answer. Less than 10% of the time, between 10 and 25% of the time, between 25 and 50, 50 to 75, or more than 75% of the time. Okay, look at the results. All right, pretty evenly split, with mostly in less than 10% of the time, with 24%. Alex, Christina, any reaction to that about what you expected, or any surprises there?
This is Alex. About what I would expect, I am a little surprised about the less than 10% of the time. That's a little bit higher than we typically see, but that's also good. It shows there's a lot of research and engagement on the employer side. So that's good news.
Mm-hmm. Okay. All right, let's move to the second polling question for everyone then. And again, a reminder, this is the broker polling question only. Brokers only. How many times do you normally meet with your client per year? 1 time, 2 times, 3 times, 4 times, or 5 times or more? And we'll give you about 30 seconds to answer there. Okay, we've got enough time. We have the next slide. 27%, 4 times or more. And about a quarter for 3 times or 5 times or more. Any thoughts on that, Alex or Christina?
Yeah, this is Christina. Just about what I would expect. I think it kind of depends on the benefit year and what types of changes employers are looking to make, but I would say that's about right.
Okay, great. Let's move to the next slide, which will be focused on benefits employers currently offer versus benefits they plan to offer. And this is interesting. I think if you look at on the left-hand side, the bottom 3 or so answers, it's quite interesting if you look at that. And also at the top, we notice that EAPs, FSAs, mental health plans are among the most popular. And a topic that we've written about quite extensively has been telemedicine. So that's also in the mix. And I think what's interesting here is we'll see, as I mentioned on the bottom left corner, we see that while critical illness, price transparency, and health concierge are among the lower levels of market penetration as an existing benefit, they're also the 3 of the highest in terms of what employers are planning to offer in the next 12 months. And you'll see that on the top right side. Christina, Alex, does this match what you're seeing? I'd love to get your perspectives on this finding. Maybe Christina, if you want to start.
Yeah, absolutely. I'm not surprised by this at all. Actually, I think it's really consistent with what we would expect. I think it's quite consistent. I mean, I don't know, Alex, do you have anything you might want to add?
No, I would agree. This is very much in line with what we're seeing across our client base and additionally when we speak with our prospects. So this is very much in line with what we see as well.
What about the issue of telemedicine? I mean, telemedicine is something that we've written a lot about at Employee Benefit News and Employee Benefit Advisor. We've had, I just noticed like half a dozen stories in the last few months about just how to make wellness programs work. Various companies are adding telemedicine as a benefit. I'm curious if you have any views in terms of that, in terms of what you're hearing from clients or just people you're hearing from in the industry in terms of the popularity of telemedicine.
Yeah, I mean, so this is Christina. From my perspective, I think that we've leveraged a telemedicine provider. Actually, we leveraged First Stop Health for probably the last 4 or 5 years, and I think that upon first implementation, I think employees were a little bit hesitant and reluctant to latch onto it and really understand how it can be beneficial and how it fits into the overall benefits package. But I think beyond the first couple of months and once word of mouth starts to hit, I think it's become a really popular benefit for us, and more so than probably we would have initially thought. So I'm not surprised to see that many employers are now starting to use this benefit and really starting to put it in. But I think that the approach and how that implementation goes and the way in which employers kind of marry it with the rest of their benefits program is going to be critical in order for it to be successful. So to see it in the top 5 doesn't surprise me at all, and it's right there in line with wellness programs, which I think makes perfect sense.
Yeah, and from a broker perspective, I think I would agree with Christina. We see the same thing. It's usually less of having to implement a telehealth benefit and more of choosing the right strategic partner. So I definitely would agree with everything she mentioned.
Great, thanks for those perspectives. Something that kind of struck me was that nearly 1 in 3 employers have no plan to offer in terms of any additional benefits in the coming year. It seems to imply that they're holding little expectation that any new benefits or cost containment strategies can make an impact. I mean, that's kind of my interpretation. Any thoughts on these, or shall we move to the next slide?
I mean, I think
okay,
probably
so,
I was just going to say, I think probably the 1%, you may find that it's just employers who are a little bit change adverse or maybe a little bit slow to change. So I wouldn't be surprised if that number were to reduce over the next several years.
Okay, thanks. So the next slide, we're looking at implementation of cost management strategies and what cost management strategies are recommended on the broker side. So behavioral health, employee assistance, discount programs, health concierge, all had a significant difference between employer plans to implement as a cost containment strategy versus the opinion of their broker. The only cost containment strategy that both the broker and employer share as a top strategy is modifying the employer-employee split on premiums. So, I mean, beyond cost shifting to employees, it appears that employers seem to hold out significantly less hope that there are other cost containment strategies that are likely to be effective in impacting healthcare costs versus what brokers believe. So I'd love to get Christina and Alex to weigh in here. I guess from the employer side, what is your process for evaluating how last year's new benefits performed and what benefits you might consider adding in the coming plan year?
Yeah, absolutely. So from the employer side, I mean, enrollment and engagement are really 2 huge factors in evaluating how well benefits are performing and really how engaged employees feel about those benefits, whether or not they're resonating with them. We certainly will hear feedback from employees if things are not performing well or they're not performing as expected. So always keeping that in mind. But as far as considerations for future years, obviously, reviewing benchmarks, plan design benchmarks is critical for us. We do that every year. We also review claims experience on a very regular basis, keeping in with our budget requirements. And then finally, I'd say we look at national surveys to just understand general marketplace trends. What are our peer companies doing? What are people who have similar claims experience with certain populations? What are they doing to contain costs? So I think that it's while keeping our budget in mind, it's really important that we evaluate solutions that give us the most bang for our buck. We don't want to put in solutions that are maybe really great for certain, let's say, organizations, but we don't have a large population that it would impact. We try to stay away from those. So certain benefits really have a bigger impact than others for us.
So of those, is there any really key metric that you really focus on? Is there one that you could point to, or is it just a set of them?
I mean, I think we probably have our top 5 or top 10 that we go to, right? So understanding the enrollment across all the different plans, understand which, not only kind of your medical and prescription, but also understanding which voluntary plans colleagues are engaging with. But then the claims experience is a big factor for us as well. So I would say between those 2, kind of balancing the 2 and considering both, how does that influence the budget?
Okay, let's get Alex in here. Alex, from the broker's point of view, I mean, what preparation do you normally do in advance of a renewal or strategy meeting?
So we believe in a strong consultative approach, which means that we're usually in front of our clients on average about 5 or 6 times per year outside of open enrollment. And our process is usually always starting the same way. We start with a thorough review of raw claims data. So when we take a client over, we automatically feed their medical and prescription drug claims into our data warehouse. And before any of our meetings, we pull the data through the most recent quarter of the year, compare it to prior years in order to really evaluate plan performance, claim and member behavior trends, gaps in care, high claims, provider performance, and other items. And we begin starting to plan our renewal strategy about 6 months in advance. And again, it always starts by reviewing the data internally with our actuarial and our clinical teams. We also request pre-renewal exhibits from our vendor partners. And so as part of our process, our actuaries will create a pre-renewal analysis based on the data, which includes a preliminary rate valuation for the upcoming year, a budget for the client's financial committees, and a true financial picture as to how the program is running. We then plan our meetings around our findings and revise our 3-year strategy if needed. And lastly, I would say that we create a list of the recommendations based on clinical trends and gaps in care that we're finding. For example, if there's an opioid abuse program that we need to plug in, and we focus on how we can increase the client's value proposition through benefits. Our early planning really allows us to be ahead of the busy renewal season, which gives us leverage to negotiate the renewal as needed and market appropriately in a strategic manner rather than rushed. And once the renewals are in place, usually by September for our 1-1 groups, we will plan open enrollment and then, host the presentations and those things. Our clients really have become accustomed to our process, so much so that they start anticipating our next meetings.
Okay, thanks, Alex. Why don't we move to the next slide? So you can see here at the bottom left, nearly 40% of employers don't plan to implement a new cost containment strategy in the next year. This could be because employers are not confident in the effectiveness of other cost containment strategies. You also see here on the right, only 5% of brokers do not plan to recommend new cost management strategies in the next year. From the broker's perspective, of the top 5 cost management strategies, only wellness, telemedicine, and offering high deductible health plans are actually benefits. That's in the top right section. So both employer and brokers saw 3 different ways that reducing drug pricing could be a cost management strategy among their viable strategies. This is also among some of our findings here. So Christina, starting with the employer perspective, what are some of your plans to reduce costs, and how will you measure those plans' effectiveness?
Yeah, absolutely. So claims experience, again, I think that's something that's going to be probably I'll repeat over and over again, but claims experience really kind of tells the story. So for us, we are constantly in contact with our PBM to understand, and our broker to understand where the cost drivers are coming from. Is it specialty medications? Is it those who are maybe not being compliant and then needing additional treatments? So we really focus on those claims experience categories, and thereafter then communicate heavily on certain topics, right? So whether it be, changing behaviors such as filling with mail order or generic alternatives, pharmacy shopping, brand shopping, that type of thing. Those are kind of our typical strategies year over year, and that tends to work really well for us, especially when we have spikes in certain categories of drugs. But for 2020, we're actually evaluating a particular technology that helps support colleagues with just being a better consumer. So we're excited about looking into different technologies that would offer that for us, and allowing a little bit more access for the employee to really have real-time information around the drugs that they're taking, where they can save some money, and how to just be overall better consumers. So the more education that we're able to provide our colleagues, we find that they tend to be just better participants of the plan in general.
Great. And then, Alex, the same question, just from the broker's perspective, please.
Sure. So the prescription drug world is really ever-changing, and it's quickly growing to be a significant cost of medical spend. The recent forecast is showing that 50% of overall medical spend will be prescription drugs by 2020. And so traditional approaches such as step therapy and other adherence programs, while they're valuable, aren't really enough to tackle the rising costs and increasing utilization of specialty medications, which typically are driving this trend. So from our perspective, we've had to become more strategic, and we've had to make some changes as to how do we approach this. We decided as a company that we needed to invest in a technological solution which allows us to identify the profit margin of the PBMs. This then allows us to squeeze additional waste out of client contracts and ensure that the client is not only receiving 100% of rebates for all medications rather than a selective set, but to make sure that all of the contract terms are effective in really driving savings through the contract without any type of disruption to the membership and without affecting the actual design of the program. We can currently replace the existing PBM contracts without changing the formulary or, like I mentioned, the plan design, and we're achieving an average of 18 to 20% savings in prescription drug spend just through contract manipulation alone. We typically perform this exercise every 2 to 3 years and refresh the contract without member disruption behind the scenes. In the event we have to go market and find a different PBM, we certainly will do so, and we migrate clients with less than 1% of overall disruption. We've seen tremendous success with this approach, and our clients have been able to really utilize the savings to offer bonuses, raises, increase the retention, and even offer additional benefits requested by the population.
Great, thank you, Alex. So let's move to the next slide, where we'll be focusing on the section on effectiveness of cost management strategies. So if you look at this slide, you can see that 3 of the 8 cost management strategies employees are considering are cost-shifting strategies to employees. High deductible health plans and modifying premium splits and changes to co-insurance. Both brokers and employers agree that HDHPs, claims analysis / data analytics, and preferred drug formularies were among the most effective cost management strategies. Christina, what do you make of these findings, and how do you use or plan to use claims data analytics to help reduce costs?
Yeah, thanks so much. I think that, claims analysis is something that probably every employer and every broker is constantly trying to figure out the best way to leverage that information, because it's such great information if you can just apply it, appropriately. For us, the way we try to best leverage it is through targeted communications and carrier-specific programs. So we'll take the claims information that we have, and if we know that we have very high claims costs, or, surrounding diabetes, then we'll target specific diabetes communications to our population. We'll make sure that we're leveraging any of our carrier-specific programs that they may offer, spending a little bit of extra money in the areas that we know we can make the biggest impact. Additionally, we'll leverage some third-party vendors, our wellness vendor potentially, to run certain challenges or initiatives around those claims that we can kind of put a bow around, I guess. But it's really important for us, at least, to make sure that we're targeting any conditions that might be an issue with, like, let's say, low compliance, things like that. For us, too, and I think I mentioned this earlier, we do really want to understand if our cost drivers are aligning with our peer organizations. So, for example, if we're looking at our manufacturing population, there tends to not be much you can do about, the highest item on your claims analysis being musculoskeletal, right? I think in any manufacturing situation you would expect that. So for us, as long as we're not seeing any kind of major outliers or major concerns, I think we'll just kind of focus on targeted communications, targeted programs for the particular populations that we know that we can impact.
Interesting. And Alex, how does McGriff use claims analysis to help you reduce the cost for your clients?
To be honest, data analytics is truly the core of our consultative approach. Without tangible data, we are ineffective in being able to really help our clients. We mine the client claims data on a monthly basis, and we present our findings at least quarterly to our clients. And oftentimes the data will reveal gaps in care which need to be studied further. The data really tells the story. We don't try to fit the story into the data. And sometimes the story helps us address questions such as, what are the barriers that members face? Is it financial? Is it behavioral? Is it access to providers, or is it something else? We really stratify the data as much as we can to put together recommendations on programs or value-based plan designs to address the risk that we find in groups' data. And so I put together a couple of examples that I think would be helpful to really show how this is effective for us. Through the data we find there's opioid abuse in several of our clients' prescription drugs data set. And so we immediately start working on programs to tackle and address this head-on. And we work with our PBM, our medical clinical teams, our pharmacy consultative teams, and we not only implement the program to target the issue, but we work with physicians that are prescribing these medications. Sometimes a member will take 10 and the physicians don't know that there are that many going on. And so we've been able to reduce opioid abuse as much as 86%. Another example, which you've probably seen in headlines, is diabetic supplies and insulin. For many of our groups, there's a large gap between taking care of yourself if you have diabetes. Many members are not getting their A1C, taking their insulin, or getting their supplies. And we're finding that a lot of it is cost prohibitive to the member. They're actually balancing whether they should pay their bills or get their supplies, which is never good. And often it leads to a member having more critical conditions, going to the ER, being admitted, and so forth. And so we start addressing that with value-based insurance design. Do we need to make the insulin covered 100% and make the access a little bit better for the member? And so once we started implementing various designs and programs, we start to see an increase in A1Cs and a reduced amount of complications. And then the last one is really end-stage renal disease. This is a little bit unique. One of our clients had 6 end-stage renal disease claims on file, which is very rare, and it was all for spouses that have healthy lifestyles and they're in their mid-30s. Much digging into the data, we found that they all lived within a specific radius of Flint, Michigan, and after working with community programs, we were able to determine that it had to do with something that was going on within their particular community. Less than 6 months later, the headlines hit about the Flint water crisis. So to say that we use the data, we have to use the data, otherwise we're just not going to be effective.
Wow, those are great examples. A really interesting story. I wish we had more time to go into this some more. Let's move on to our next section, which is a focus on engagement. My main takeaway here is email is not dead. While email was the most effective communication method, followed by in-person information, a full 44% of employers felt that customized communications were effective. Only 5% of employers felt the vendor was primarily responsible for driving employee engagement, and only 11% felt it was the broker's job to drive engagement. Not that surprisingly, most, 85% said it was the employer HR team's job. So I'm really curious what you guys think. Christina, do you agree with these findings? What has been most effective for you, and what does customized engagement mean to you, or how have you applied that in your job?
Yeah, absolutely. I definitely am not surprised by these findings at all. I think email is absolutely the top communications method without a doubt. And I do feel like in-person information sessions are really kind of shortly behind it. So this kind of aligns, I think, with what people tend to find as the easiest method of communication, followed by probably the most effective, which is in person. For us, I don't feel that there's one form of communication that's most effective. Certainly email gets the point across with a way to be very clear, a way to put down everything that you need to in one place, and also to have kind of consistent messaging across your entire employee base. But we do run into an issue where, there's too much email overload and people don't tend to read all of their email, especially if it's coming from HR sometimes. So I think a lot of us have that to combat with. For us specifically, we have a population that ranges really widely in age and generation. So we really have to focus on making sure we're varying our communication strategies. Our colleagues have mixed access to technology. Not everyone sits in front of a computer all day long. So we really needed to think about how we're going to best communicate with our employees. The way that we handle that is, yes, of course, we make sure we send out an email for every kind of important or critical message we need to get out so that it's there in writing for people to reference. But in addition to that, we definitely leverage in-person meetings wherever possible. We try to leverage webinars wherever possible, even some customized videos, some things that we can put on our closed network TVs and our manufacturing sites. Mailings home are critical because your employee may not be the decision maker. Their spouse or someone in their family may be the decision maker that we need to get that message to. So certainly we absolutely have to do a mixed and varied communication method for all of our different populations of employees. I see a lot, and I'm surprised actually I don't see on here like text messages and push messages, because I think that's something that's really
that was surprising.
Yeah. Is that am I missing it, or is that not on here?
It's not on here.
Yeah, I'm surprised because I think that so many third-party vendors tend to be kind of pushing that initiative, and I think that a lot of employers are a little bit reluctant to, to provide employee phone numbers, or maybe employees are reluctant to get messages from their employer via text message. So I think that's probably going to be the next wave of what people end up wanting to communicate in that way, but we probably just aren't there yet. And I mean, as far as responsibility for employee engagement, I completely agree that it sits within, within HR, but I think even within HR, it needs to be really a team effort. You'll have folks, at your corporate office who are maybe generating the toolkit and materials, but if you don't have the support and really engagement of your HR site team members, it's going to be much more difficult to get the message across. So while we definitely use our benefit broker and vendors as support for maybe generating some of the content, for us, the responsibility absolutely sits within our corporate office.
That's really interesting, and particularly your observation about the texting. So speaking of brokers, Alex, from the broker side, what have been the most effective communication methods at your various clients to drive engagement and utilization of benefits?
Sure. So from our perspective, it's a little bit different, I think, from an employer perspective, because the employees are going to give attention to certain forms of communication differently if it comes from their employer or a broker or a vendor. And so we personally have seen that us hosting employee forums are truly the most successful form of communication, and from our perspective, based on our client base. We typically hold them quarterly or biannually in addition to open enrollment meetings, and during the forums, we have a great opportunity to highlight benefits that may have low utilization, such as EAP and telehealth and others that employees may only hear about during open enrollment traditionally, that we really want to drive to be a core benefit for them. We provide refreshers on other resources that they have available, not necessarily a benefit, but something that's tied to their benefit. And we've received some pretty decent feedback after each of the forums. The members will come to us and thank us and sit down to talk about specific claim issues or vendor issues that they may be facing. And so we've decided that for every one of our clients, we have a dedicated inbox where the employees can contact us with their benefit questions, with claim issues, provider problems, et cetera. And our intervention helps to resolve the issues faster, and it gives us another touch point with employees where we can then, again, remind them about a benefit or a resource that may be helpful based on the issue that they're facing. Additionally, we provide some monthly and quarterly newsletters, flyers, and other reminders. And when we combine both of these, the approach really increases the utilization and enrollment in our client benefits. If we see that the impact is minimal, then we will survey the population to understand, is there an issue with the product, or is there a barrier that exists for the employee which we need to take into consideration? Our clients really partner with us during these efforts, so it's less of a holding someone accountable type of situation and more of a team effort to really increase the utilization and understanding of the offerings.
Great, thank you. So we touched on metrics earlier. The next part of the research focuses on metrics employers use to measure cost management strategies. And for employers, while HCHPs and modifying employer-employee premium splits were among the top cost containment strategies, they were among the lowest in terms of ROI as a measure of success. So based on the findings of the First Stop Health research, 3 out of 4 employers are mostly measuring participation and utilization of telemedicine, but not ROI, where less than a quarter of employers measure for ROI. And it seems like this may be because they don't have a clear strategy for measuring ROI in this case. For brokers, while brokers are recommending mental health, both EAP and behavioral health cost containment strategies, few are measuring for ROI. For cost shifting strategies like changes in coinsurance and high deductible plans, measuring enrollment is high. So I'm curious if this matches what you're seeing at Alonzo Group, Christina, and how do you measure success of both existing and new benefits?
Yeah, absolutely. I mean, I do think it matches what we see at Lonza. I think that it's really difficult to measure ROI in a lot of instances. First Step Health for us makes it pretty easy because we are able to really quantify the costs that an employee would be incurring or Lonza would be incurring had they gone to their primary care physician, the emergency room, urgent care. Those are really easy to quantify, and the number of cost avoidance instances by using telemedicine as opposed to visiting one of those other providers. So I think for us, measuring ROI in telemedicine has actually become really easy. Thankfully, some of the other things, such as wellness programs and things, I think are much more difficult to measure. So I'm not surprised that employers are not doing it as much because it's not quite as easy to do. For us, the measurement of success is enrollment and utilization, but I think that what kind of speaks a little bit louder than that is about the fact that we really like to hear from employees directly. The testimonials or just kind of side conversations in the lunchroom, those are the things that really resonate with our HR team, with our leadership. They want to hear which benefits really make a difference for employees and make a difference in their lives. So the one really nice thing about First Step Health for us, at least, is that they will provide those testimonials for us. But regardless of if they were to provide them, we hear them on our own. So I think that's really a big differentiator when you're looking at different benefits of how an employer can kind of measure that success. As far as how long do we wait before kind of replacing, I think that we don't like to pull benefits immediately. We really, we kind of like to give it 12 months, but we really like to understand the root cause as to why it's not working. A lot of diligence and effort and strategy goes into putting a benefit in place in the first place. So if it's not working, and we kind of felt that it was going to be a really successful benefit because that's why we would have put it in, we really try to wait 12 months to see if we can resolve whatever the issue is, unless it's something that's just kind of an unreconcilable difference of sorts, right? So I think that we really try to understand the root cause of the issue before just kind of pulling a benefit.
Okay. And Alice, what about at McGriff, how do you help your clients see the value of benefits that you have recommended?
Sure. So it really goes back to data again. Before we ever make a recommendation, we have to make sure that the data supports the need, and then we make our presentation to the C-suite and the HR teams together because both of them are equally important in trying to decide whether this is a need for their employees and how to implement it. We include case studies as part of our presentation to show the results that have been achieved by other clients that we have utilizing these methods. And then once we implement the product, we exercise a multi-prong approach. Our first step is to review the data to monitor the utilization pattern since our recommendations have been implemented. If we notice that the recommended benefit vendor or plan change isn't really performing as we anticipated and the data isn't really enough to reveal the issue, then that's when we will typically go back to our teams and recommend surveying the population. And it's been a successful approach for us because we find that employee feedback is pretty powerful. They're very honest in these surveys as to what may or may not be working. And it's crucial to our analysis to help us understand, is it something that we missed? Did we miss a step? Is the culture of the employee base requiring us to tweak the recommendations a bit more? And it helps us to also understand if potentially a vendor is underperforming. Do we need to have an expectations meeting with our vendors, which typically will resolve the case if it occurs, or do we need to look at a different approach like potentially marketing for the future? But like Christina said, we do also recommend at least giving it 12 months because the dynamic tends to change during different portions of the year once it's been in place.
Great, thanks. So let's get to telemedicine. I know this is a topic that's really of interest to the EBA and EBN audience. Here we see brokers in red here and employers in blue. Both brokers and employers see high levels of service and support as one of the most important features of a strong telemedicine benefit. Christina, what's been your experience with telemedicine, both with First Stop Health as well as other providers? And then what, if any, significant differences have you experienced?
Yeah, absolutely. So I would say we started off, our experience with telemedicine probably started off with Capsugel several years ago, and that was the first time that we were really considering adopting a telemedicine solution. We went out to several of kind of the big name providers at the time and just really didn't find something that was a good fit for our organization, so we kind of dropped it. We were then approached by First Stop Health, who I wasn't actually familiar with back in the day when we first put it in, and I was interested to understand their guaranteed savings kind of approach and ROI guarantee. So I think that kind of captured the interest of our HR leadership. It took our colleagues a little bit of time to really get accustomed to how telemedicine is different from, let's say, a carrier nurse line or something like that. But I think that with our strategy with telemedicine is we were implementing it around the same time as we were considering full replacement CDHP. So when we were, as we were doing that, we really felt that we needed to provide colleagues with an option to speak with a doctor and have access to a doctor without having the risk or worry of a really high cost emergency room visit or urgent care visit. And so our strategy was to implement telemedicine without a copay or fee. And so Lonza takes on that responsibility for the employee. So there's really no kind of risk on the employee's part in leveraging the benefit and using telemedicine. Once we've kind of got that under our belt, then we ended up seeing utilization that kind of it was flat for maybe the first month or two, and then it spiked through the roof. And I think it's just a function of, the first couple of people using it, and then word kind of spread like wildfire. So it ended up working out really, really well for us. We, again, are a little bit different because we have a manufacturing population, very big 24-hour population, combined with just your regular professionals. Scientists, we have, a really significant and varied population of different types of employees who receive information differently, like to learn differently. So I think that the ramp up to utilization was just unique for us. I didn't find that with some of the other provider solutions, they were able to kind of adequately reach each type of employee that we had. So that for us felt like a differentiator for First Stop Health. So I think that between those kind of couple of things, the word of mouth, the varied kind of communication strategies that we've put into place, and then also not charging a copay or any type of fee to use the service for our employees has made the program really, really successful for us.
Okay, and then for the broker perspective, same question for Alex, please.
Sure. So most of our self-funded groups already have First Stop Health in place, and that was primarily done on our part because we were looking for a strategic partner on the telehealth side. We have a lot of groups that came from Teladoc, Amwell, and Doc on Demand, and so we've had a unique opportunity to really compare the services between First Stop Health and the other telehealth providers, and we really do prefer to place First Stop Health because of the approach with targeted marketing, the way that the eligibility is loaded on the front end, so members not having to complete a profile when they're in need of care, and then, of course, the guarantees that are built into the contract and the ROI. Based on our client survey results in terms of our administrative teams, our groups that have First Stop Health find that their employees are a lot more satisfied with the telehealth product than other clients with other solutions, and this is primarily due to the way that the physicians at First Stop Health handhold the members during each of the visits. The average utilization with our non-First Stop Health clients is between 2%, maybe 1.5% to 2%, whereas we're seeing on average a 40 to 50% utilization rate with First Stop Health, which is tremendous. Most of our clients are shift employees, manufacturing, oil and gas, groundwater, marine, and so their employees need something that's working for them appropriately around the clock when they can't leave. And, of course, our clients want to provide as much time to their employees on site so the employee doesn't have to leave to go sit in urgent care and ER and so forth. And so the top 5 things that the employees have reported is, 1, cost. They don't pay for the product, so that's automatically a win. They can use it at any time. Their family can as well, and they don't have to be concerned with cost. The ease of use. They're identified through a census upload, not forced to create that profile, which is usually a problem and a sticking point with others. Interaction with the physicians more personal than with other vendors. They feel the physicians take their time. The marketing targets the dependents who are really more likely to utilize the product. And lastly, the employer groups really appreciate the detailed reporting on a quarterly basis that's provided by First Stop Health.
Great, thank you. So on the topic of employer benefit priorities, both employers and benefit consultants see reducing costs for employers as more of a priority than reducing costs for their employees. And yet employers see improving the financial wellness of their employees as more of a priority than brokers believe they do. So for Christina, we want to note a recent Gallup West Health survey that said 25% of respondents said they put off medical treatment because of cost, and 45% are afraid they might go bankrupt in the event of a major health event. The link is here if anyone's interested in taking a look. Given this survey results, Christina and Alex, what is the most impactful way to help reduce healthcare costs for your employees or clients' employees in Alex's case?
Yeah, absolutely. I mean, I think it comes down to a few things. Really two things for us at least: choice and education, right? So, how can they mitigate costs? Well, if they're not educated about the plans that they have in place, then they're not going to know when they're underinsuring, overinsuring. They're not going to know what to do and who they have access to as part of the employer program. But choice is also a really big factor to it. You have to provide colleagues with enough choice to be able to select the right insurance. At the end of the day, if you're a larger organization, you're paying the claims anyway. So what you want to make sure that you're doing is providing colleagues with enough choice on the medical plan to make sure that they're selecting the right sized plan for themselves, and then supplement that with the voluntary programs, benefits, free employer plans, benefits, EAP, all those other types of things that will help supplement their medical plan choice. So in the case where you mentioned, employees are, afraid that they may go bankrupt or have to take out a loan in order to pay for medical expenses. I mean, this is something that we're really, really doing our best to avoid. We want employees to be focused on their work and their work-life balance and their family when they're at work, not about their financial burdens and medical expenses. So the benefits that we try to put in place need to be sustainable. And in order for them to be sustainable, we need to make sure that we're allowing employees enough of an opportunity to select the right plans that are right-sized for them, and also, have a reasonable share in that cost, right? So for employees who are worried that they're going to maybe have a large accident or something during the year, we need to give them an option that's going to cover them in such a way that they don't have to worry about getting such a huge hospital bill. But for employees who don't need that type of coverage, they shouldn't be kind of forced into a plan that's going to be so expensive for them that if they do have something, they're worried then about making ends meet. So I think making employees the best type of consumers of healthcare that we can is really our focus, so that when it comes time to use the benefit, they know the resources and that they have access to, and they know where to go to get kind of the right help and the right answers.
Sure, and from a broker perspective, we're seeing this problem be the number one cause of issues with cost within our client base. So the employees are having to defer their care due to the cost of care, deductibles, and cost-sharing components. And we have to look at this more holistically in terms of how do we contain the cost. Cost shifting to employees isn't an adequate strategy, and it really leads to increased deferred care, which ultimately hits the employer's bottom line. I've heard so many employees tell me that they self-triage themselves before going to the ER. An example includes a member who tried to evaluate whether they were having an anxiety attack, a heart attack, or if it was heartburn. And they decided not to go to the ER because they couldn't afford their deductible, and unfortunately ended up with a serious heart condition, which later exceeded their stop loss. And so obviously this is not an effective strategy. Our approach is we have to be a little bit more strategic behind the scenes to really contain the cost, which can include medical bill review, making sure that clients are not paying for medical errors, redundancy, and fraudulent claims. These are physicians that are scrubbing the itemized bills before they're paid to identify all of these errors and have them written off by the provider. And the provider always writes them off because it is an admission of malpractice if they keep them in the actual bill. And, of course, they're able to speak peer-to-peer, physician-to-physician, and so there's really no pushback on this. And it's something that every client really should have in place. We also make sure they have a proper medical vendor. A lot of what we call the BUCAs, the Blues, United, Cignas, Aetnas, and so forth, they just don't have fraud filters, and in some case, provider claims are preserved from being audited by specific networks. So a proper vendor with proper support for client initiatives and giving flexibility to the employer and providing some aggressive clinical approaches really helps to zero in on the risk and the rising trends. Additionally, we have to make sure the plan design fits the population. High deductible health plans have become a barrier to health care. Employees can't necessarily afford to fund their deductible or their HSA in certain segments of the industry. Of course, I mentioned a lot of our employees are in manufacturing and shift employees, and so it does not work for them. So we have to pair it with something that does work for them. A lower deductible health plan usually is a better solution, and we see utilization uptick with actual management of the condition rather than just catastrophic claim management. And then, of course, we repriced prescription drug claims over the last 12 months, and we go through our pharmacy exercise to make sure they have the appropriate contract. And then lastly, of course, the proper telehealth solution so that we can reduce not only time away from work, but getting employees away from the expensive emergency rooms and not even having to go to an urgent care is a win for an employee because they're not paying that copay. We do have other recommendations, but they really are based on client-specific data. These are just the approaches that we find to really work to really narrow down on cost containment.
Great. Thank you for that insight. So that brings us to our last set of polling questions. We want to make this an interactive webinar, so if you could all get ready. I'm going to read off the first, again, this is for employers only, the first employer polling question. How accurately do your employees value the benefits of your company, that your company provides to them? We'll give you about 30 seconds. Much lower than the actual value of the benefits, somewhat lower, approximately the actual value, somewhat higher, or much higher than the value of the benefits. In a few seconds. Okay, ladies, what do you think of these results here?
This is Alex. From our perspective, I would say that's pretty accurate with what we see.
Yeah, same here.
Okay, let's move to the last polling question. Again, this is for brokers only, please. The broker polling question, what is the biggest reason your clients agree to add a new benefit? Reducing costs for the employer, reducing costs for the employee, a strong ROI, significant convenience for the employees, or as a recruiting and retention tool. Give it another 10 seconds or so. Let's see the results. Reducing the costs, an employer wins here, I guess, and followed by as a recruiting and retention tool. Any thoughts on that? Either one, Christina or Alex.
It's spot on from our approach from the broker side.
Yeah.
Yeah, not surprising at all.
Okay, great. And our last slide here is just some verbatims from our respondents. For brokers, the challenges in delivering value for clients are numerous, and at the core involves helping a lot of clients balance the high cost of benefits with the need to have an attractive benefits, to actually, recruit and retain employees. Obviously, you can have the full results if you just contact us afterward. And we do want to get to the Q&A, but before we get to the Q&A, I want to quickly hand over the floor to our host, Nick Severino from First Stop Health, who's our sponsor for today's webinar. Nick, the floor is yours.
Thanks, Walden, and hello, everyone. Wow, what a great webinar. Obviously, some great insight there and perspective from our panelists. So thank you again. I first want to thank everyone for attending today, and hope you really learned a few things. I know I definitely did, being in the business for a couple of decades. I definitely learned some things here that are changing, most notably here in the last year or two. First thing I want to do is I want to bring out the point that Walden mentioned at the beginning of the webinar that this is the inaugural version of the annual healthcare cost containment survey from First Stop Health. What I really want to do is thank the folks from Source Media, EBN and EBA, as we all know them, and their research team for helping pull all this together. So thank you guys for that. I also want to thank Walden Sue, our moderator, who did a great job moderating today. And then lastly, I want to thank our panelists, Alex Juneau from McGriff, Siebels, and Williams, as well as Christina Mushanisi from Lanza for their participation in the webinar. You guys really provided some great examples and perspective there to help give some insight onto the data. And the last thing I want to talk about is the follow-up that's going to occur. And a lot of folks during the Q&A, the chat asked about, a copy of the presentation. Later today, everyone's going to get an email. All the attendees are going to get an email from First Stop Health, where we're going to include a link in there where you can just complete a real short online form and tell us exactly what you want. Number one, obviously, is the copy of today's presentation. But secondly, and most notably, is we're actually turning this healthcare cost containment study into a white paper. We have an employer version and a broker version that we're hoping to have ready very, very soon. And in that form, we ask you which version you want. So we're even hoping that as part of this process, we want to give those folks that respond, tell us that you want it, you're actually going to get kind of an early release of it before it goes out to the marketplace as a whole. So again, look for that email. And again, I want to thank everyone for attending today. And with that, I'll hand it back to Walden.
Great. Thank you, Nick. Really appreciate that. I do think we have time for one or two questions. One of the first questions coming in, this one's for you, Christina. What are your top 3 cost containment strategies that you're looking for in the coming year? I don't know if you can boil it down to your top 3 for us.
Yeah, I mean, absolutely. I think targeted communications is always on that list. I think that which includes obviously educating colleagues on how to be better consumers. Certainly plan design changes aligning with benchmarks. We review that on an annual basis. And finally, probably there are some point solutions that we've considered recently around things such as chronic conditions to support those who have chronic conditions, more specific populations of colleagues. So, for example, there's a couple of services out there that offer support for infertility treatment, for diabetic support, those types of things. So we'll be taking looks into those as well.
Okay, I have one more for Christina. Christina, you mentioned you were looking at tools to help members to be better consumers. Can you share if you have found any of these that are effective?
Yeah, I mean, absolutely. I think that there's so many out there, to be honest. At the moment, our focus in particular for next year is on RX. So we've actually looked into a couple of solutions that provide real-time kind of cost comparisons on prescription drugs. And so although we haven't leveraged any particular, I can't be a reference for this company, but the one that we've looked at most recently is RX Saving Solutions, and they seem to have pretty neat technology. But again, we haven't personally used them, so I can't commit to how effective they really are, but they seem to have some pretty interesting solutions.
Okay, and so that's the last question for Alex. What data do you like for the evaluation of provider performance?
That's a great question. So our data warehouse will take the raw claims data that comes in, and it really helps us to, paired with our medical bill review teams, identify whether the provider may be egregiously overcharging. We look at the redundancy and the fraud and things that are popping up in that claims data, and our teams are able to, just based on claims alone, really identify whether a provider is performing the way that they should, or if we're starting to see errors with a particular provider. There are a couple, for example, through the data that we've identified in Oregon, that they were gouging employees that were on health insurance versus employees that had other forms of insurance, whether it be state-provided, federally provided, or self-pay. And so we were able to really hone in on what it is that they were doing. And then we also look at the quality as far as, do we see the actual care that's being provided by these facilities and hospitals, are they actually reaching the resolution that they need to find? And our physician panels really help us to understand that. We get that through a lot of the clinical notes that come in with the medical bill review process.
Great. Unfortunately, we have to leave it here. That was a great hour. Thank you so much to Alex, Christina, Nick Severino from First Stop Health, and thank everyone for joining us, all the employers and brokers.